Economists often explain high healthcare costs by comparing the purchasing of food at the grocery store when someone else is paying. The metaphor still works, but with a twist. Reported in a recent medical journal, Harvard researchers looked at healthcare spending here in comparison to the 10 next highest income countries of the world. They found that in 2016, we spent almost 18% of our gross domestic product on healthcare, while in the other 10 countries, spending was much less, ranging from 9.5% in Australia to 12.5% in Switzerland. That's a lot of difference. Most surprising was that the problem in the U.S. did not appear to be from overutilization, getting too much care. Here, patients saw the doctor and were sent to the hospital in about the same frequency as in other nations. While the study found in the U.S. an overuse of expensive image testing and many more specific surgical procedures, like 60% more CT scans performed than the average of the other countries, 45% more MRIs, 38% more total knees, and 32% more C-sections, still, these accounted for only a small part of the difference in spending. That said, we did send people home from the hospital a little sooner in the U.S. Overall, in the U.S., utilization of hospital and outpatient care was about the same as in the other 10 countries, and so was the overall quality of the care. The study group also noted our ratio of primary care doctors versus specialists and referral rates about the same as other rich countries. The rate of poverty was found to be higher in the U.S. than in other wealthy nations, and only 90% of our people were insured compared to 99 to 100% in all the other 10 countries. Those are big problems and could explain a partial cause for the high cost of health care here. However, the research suggested that higher U.S. spending stems mostly from the complexity of our payment system. This has resulted in high administrative costs, 8% GDP versus 3%. The higher price of hospitalizations, doctor's visits, as well as the price of drugs here. Going after overutilization will likely not help much. It would be like going to our grocery store and finding the cost of milk is twice as high as the store on the other side of town, because payment for milk here requires bargaining between an insurance company, the government, the dairy, and the grocery store. It's time to simplify.